Mary. Welcome to another episode of today's Anatomy Question. Mary Richards, it's great to see you.
You too, Lizzie.
I'm so excited about this series, so much positive feedback. And today we're going to talk about the hip joint.
Yes, the hip joint.
Okay, let me quickly introduce you and tell people why we're here. Okay, so Mary Richards, yoga teacher, anatomy expert, and mom's, so Judith Hansen Lasater's lead therapeutics and anatomy teaching assistant. Mary's working on a Master of Science in Yoga Therapy, and she specializes in joint health education. So that's absolutely perfect for today's question about the hip joint. I want to know, when I feel something in my hip joint, when I'm practicing yoga or even in my life, how do I differentiate between pain or sensation that's information and pain that is joint pain that I need to never recreate?
Yeah, so I love this question. The hips are really fascinating to me, and your mom and I are going to talk about this a lot in experientialanatomy.yoga because when you look at the hip, it's a ball and socket joint. In fact, I have one right here. So if you look at it, you can see it looks pretty simple, right? Mm-hmm. There's a cup and there's a convex head, and they seem to fit together really well. Mm-hmm. Don't do that with your hip, by the way. But the simplicity conceals, the simplicity of the structure conceals a lot of really complex action.
Okay, tell me more about that. What does that mean?
Okay, so your hip is a ball and socket joint, and it has a tremendous range of motion. And it can flex, meaning we can bring our knee up toward our chest. Mm-hmm. We can swing our leg behind us, an extension. Mm-hmm. We can turn our toes out in external rotation. Mm-hmm. We can turn our toes in, internal rotation. We can swing the leg out to the side. That's called abduction, abduction. And then we can also swing the leg across the midline, adduction.
Right, like when you're lying on the ground and you do a twist, like a yoga where you bring your knee up and you twist it over.
Yes.
Okay.
Yeah, so there are lots of things that are possible with the hip. And how do you differentiate muscle sensation from joint sensation?
Yeah.
Okay, so joint sensation changes when you change the position of the joint.
Okay.
Okay. So you know there's a problem within the joint when uncomfortable or less than desirable sensation remains in the hip joint after you've changed position.
Okay, wait, because I think I misunderstood. So it means you change the position and the pain is still there.
Correct. Yes.
Uh-huh.
Yes.
So if you're running and you feel a sensation on the same place every time in the stroke or in the gait, is that joint pain?
Yeah, you can then guess that the pain is in the joint. Okay. And running is actually a great example, Lizzie, because the way your hip, the cartilage, the shock absorbing cartilage in your hip is, there's more of it at the back of the hip.
Okay.
Because when you're running, that's where most of the load goes.
Right.
So if you're running along and that pain, that it's deep in the body, you can't quite verbalize it or pinpoint it, you can guess with some confidence that that's in the joint.
Okay. And what about in yoga? Like, what are the poses that we teach on a regular basis that are kind of tricky for people with hip issues?
Oh, how much time do we have? Okay, so the hip joint is least stable when there's internal rotation and adduction. So when we're turning the thigh bone inward and crossing the midline, that's when there's the least stability in the joint.
Okay, what are is that like rotated triangle pose, Parvrita Trikonasana?
Yeah, so Parvrita Trikonasana can get folks, or if you're doing Supta Padangusthasana on the mat,
Okay.
And you take the leg over the body like a knee down twist.
Okay. So Supta Padangusthasana is lying down, holding your leg, and then you bring it across.
Yeah.
Okay.
Now, the thing about that, though, is you're not weight bearing. You've removed gravity from the equation, so not such a big deal. But when you are in a revolved triangle, for instance, and let's say you're a very conscientious yoga student and you're walking that tightrope of alignment where you're lining,
this, yeah,
which I don't like. And then you add rotation, that's potentially injurious for the hip.
Okay, so what would be, like, what are the kind of things you've heard from students over the years? We can take that pose, for example, twisted triangle. What do they say? Or like, yeah, what do they report?
So they say, I feel pinched right here.
In the inner leg.
On the inner aspect of the joint, right in here. I feel a pinching. Well, that's because there is a pinching. Likely the labrum, this lip of cartilage that helps hold your thigh bone in place, likely it's been caught. You've got impingement.
Right.
And that causes pain. So you'll hear that, and then to compound the sort of confusion in the body, they've also got all of this stretch sensation going on.
Right, but so that's what I feel. That's my question. So if I have that outer hip, that's a pretty safe sensation?
Yeah.
Okay.
Yeah, those are large, powerful muscles.
Okay.
And it's not so much the outer hip that you have to worry about, because there's so much thick connective tissue in that area. But it's when you're moving toward the midline of the body.
So what about like a seated twist? Especially like if you bring the top knee across your body and then you can't see, oops, like this kind of a twist.
Yeah, so that the hip is really vulnerable. Because especially if you're practicing the twist with a fixed pelvis, meaning that you're keeping your sitting bones on the same plane, glued to the floor. Okay,
that's a topic for another episode.
I mean, the hip, again, the structure seems really simple, but it's actually, it's very elegant, but so complicated. And the hip is designed for weight bearing. It's designed to interact with gravity. And we want to pay attention in asana in particular, because we do ask a lot of this crossing the leg over the midline of the body. And when we do that, when we cross the leg over the midline of the body, well, the thigh bone has to turn inward. And again, that's the least stable position for the hip. That's where we have the maximal opportunity for injury to arise.
So fascinating. Someone came up to me, I was just mentioning to you before we started recording, came up to me in a yoga class last week and said they had watched the last episode we recorded about dog pose. And then she said, just in such a sweet way, yeah, I'm really wondering, my anatomy question is I'm still trying to figure out, what's going on with the lower back in back bending. Maybe you guys could talk about that. And I loved the feedback from her, but I was just thinking, oh, that is a huge topic.
It is a huge topic because your lumbar, your low back is extension when you're back bending is related to hip extension. So people will often experience low back pain, but it's actually not their low back, it's their hip.
What? Okay, I want to keep this to a short period of time. Okay, so that we're gonna have to talk about that in another episode. So low back pain it's really hip pain.
Yeah. And so the thing to remember about your hips is that they're large, weight-bearing joints that are very stable in structure. And it's that very stability created by the bony structure of the joint that enables this wonderful mobility. The pelvis is the center of gravity in the body. And so whatever happens in the hip, well, it affects the knee and the ankle, and it affects the entire kinetic chain of the vertebral column, especially the low back.
Okay, that is a great teaser. Your kitty cat is just sort of wandering through the back of the video. It's fantastic. All right, Mary.
The dog's passed out on the floor behind me.
Thank you so much for sharing some of your knowledge with us.
My pleasure. Thank you, Lizzie. I so enjoy this.
As baby anatomists. So I want to tell our viewers, if you're interested, experientialanatomy.yoga, go to that website, put in your email, and you'll stay in the loop about the digital course that we're working on with Mary and with Mom. And you'll get, I send out every time we record a new episode of this series, you'll get a little ping. So Mary, where can people find you? What's your website?
MaryRichardsYoga.com.
All right. And you can find me on Instagram at Lizzie Lasater. Sending you a big hug, Mary.
Right back at you, Lizzie.
Thanks so much. Bye.
Bye.